Lynn, thank you very much. I'm going to run through a series of PowerPoint slides, starting shamelessly with my book, which is available on Amazon and recently was translated into Turkish and Portuguese. And I'm going to talk a little bit about, this is a couple years old, I'm going to talk about research that we're doing today, and I'm going to talk a little bit about technology and what opportunities that opens up for us. I love this photo because it's the same place in the same city, 21 years apart, and it's essentially unrecognizable. I think there's only one building in the top photo that's identifiable in the bottom. And it reminds us that this is where all future growth is. This is the predominance of CO2. So as Lynn talked about, the transformation and innovation going on in cities, led by city leaders like Brendan, are enormously important and are really going to define the quality of our day-to-day life as well as the long-term quality of the global environment. In the study, in the book that I put up, Greening Our Built World, the question we asked is, how cost-effective is it, to Frank's point, to do green buildings? And we found that the benefit cost ratio is about 2.5 to 1, just based on utility bills. We fully agree with what Frank said, which is if you can make an economic case, everybody's interested. If you're making a moral case, that's a luxury. There's the health benefits as well, which are complicated to get at, but we know from a variety of studies, more than, several hundred peer-reviewed studies internationally, that the benefits of designing buildings to be healthier result in healthier buildings. This is an effort by the Seattle Housing Authority. They found the number of symptom-free days doubled in buildings they deliberately made more healthy. Clinical care visits dropped by 2/3, and even the caretaker quality of life, which is analogous to a teacher in a school, improved as well. Some of the sponsors for this book and our work include groups you wouldn't normally associate with this kind of work: the National Association of Realtors, 1.5 million members, National Association of State Energy Officials, American Institute of Architects. There's no environmental groups, not because they're not admirable, but because we wanted the research to not be immediately tagged as something that had a specific environmental objective. In the work that we did, we were able to quantify for the first time some measurable benefits working with groups like Carnegie Mellon, including productivity and performance increases of 3%, increased future earnings. This comes out of the relationship between test scores, quality of schools, and then the link between test scores, future earnings. That's relevant to cities because it drives your taxable base. Reduction in asthma. I've got 3 kids, one of whom has allergies. His productivity is dramatically affected by whether or not those allergies are triggered. Reduced cold and flu symptoms, reduced teacher turnover. So these are small impacts, 3%, 10%, but because the cost of an M.P.A. is so large relative to the cost of the building utility, it drives very large dollars per square foot impact. So when you add in the health benefits, you're looking at a ratio of around 10 to 1 on a benefit cost ratio on a net present value basis over 20 years for doing green buildings. There are a lot of additional benefits we were not able to quantify. This is work that was done by the World Green Building Council, and essentially looked at the relationship between the price of green buildings and done by countries and then done over time. And you're seeing consistently higher prices for green buildings in a variety of countries in Europe, in Asia, and North America. So the market is really responding to the choice between a building that's designed to be deliberately healthy and efficient versus the conventional design strategy, which is to barely meet code at lowest cost. Not a very inspirational aspiration, barely meet code at cost. When we buy a 1/4 ounce bar of chocolate, we get all the ingredients, and yet we know virtually nothing about the quality of air that we pull into our lungs 3 or 4 times a minute for the duration of our workday or our study day. And this is the direction we're going in, driven, I think, to a large extent by LEED, the National Green Building Standard. The growth of green buildings has been really interesting. Green buildings are a driver for health. Health is one of the 5 dominant design criterias in LEED. What I think is interesting here is in the economic downturn we've just come out of, there was a question about whether or not green buildings would continue to thrive or whether we would turn back to basic building design rather than green being a superfluous option. It turned out to not be the case. The growth of green buildings has been very dramatic. Today, half of non-residential construction in the United States is being designed to a LEED standard, half. 8 years ago when I've been involved in green buildings for about 20 years, but 8 or 10 years ago it was about 1% penetration. So this is about 1/7 of our economy, some measures larger, that in the space of less than a decade has gone from being an anomaly, an outlier, to being the design standard, and that has tremendous positive implications for health. We're doing work now with DC, with the Department of General Services. 2 of the advisors on that are Lynn and my colleague Brendan. What we're trying to do is understand in detail the full set of costs and benefits for green roofs, cool roofs, and then the use of solar energy. There are 2 parts to this work we're doing for DC and then work we're doing on affordable housing for a foundation in New York City. Some of the benefits for cool roofs are direct and indirect. And you imagine a cool roof means you're reflecting a lot of sunlight back to space. It means the building doesn't heat up. It also means the area around the building doesn't heat up because you're not taking that heat which you've converted from sunlight and releasing it back into the urban environment. As a result, the temperature remains lower both within the building and around the building. The consequences for what's called the urban heat island are large in terms of driving health impacts through ozone formation. Green roofs, similar but somewhat different benefits. Green roofs retain water and release them gradually. You've got a green growing medium on top of the building. The one in the middle is actually the WWF building where our offices are, and then solar photovoltaics, all of which have a broad range of somewhat complicated health benefits. We've worked very closely with EPA in trying to map it. I believe this is the first time there's been a rigorous mapping of the health implications of these design choices for cities. We'll have, I think, a first sort of publicly available analysis of this out before the end of the year. I think the point here is that there are a set of benefits that we think are measurable. They've really only been enabled by the creation of something called BenMat, benefits mapping software tool developed by the EPA, combined with some other software. This is so recent that we actually identified some issues in BenMap, let EPA know, and they've gone back and corrected them. It turns out a big issue is PM 2.5 concentration that has large health effects, as we know from epidemiologists like Lynn and others. And this turns out to be a big dollar per square foot number on a net present value analysis for these design choices for roofs. These are just different pathways about how this design choice affects health. A little hard to read, I realize. There's mortality and morbidity implications from urban heat island. So because the temperature of a city rises between 5 and 10 degrees relative to the countryside around it, because cities absorb sunlight and re-release it as heat, it has very large health implications, including ozone. And the frequency of premature deaths in cities is rising. It tends to be on the top floor, low income apartment with a dark flat roof. In Europe, a decade ago, there were 50,000 premature deaths in one severe heat incident during one summer. Looking at some of these, I should say, are preliminary findings. If you look at the relationship between cool roof, which is a highly reflective, tend to be light color roof compared to a conventional dark roof, or a green roof where you typically have trays of grass or sedums or other green growing materials, or PV photovoltaics, you see that the benefits, there's significant costs for the green roof, in this case about $20 per square foot, When you start to map the benefits, a very big piece of that is your stormwater benefits. That reflects DC's decision to, instead of constructing or putting money exclusively into construction of large water treatment facilities, instead provide incentives for that water to not flow off buildings and streetscapes and roads. And DC, in one of the many areas, it's had national leadership. This is it. You'll see PM 2.5 is a pretty big dollar number here. This is actually high. That's for solar thermal. But you can see the health benefits, which have never really been quantified in this kind of analysis before, contributing quite substantially. So almost $3 a square foot for a cool roof. Thank you. A cool roof, again, the cost premium for a cool roof's a little under $1 a square foot. If you're looking at health benefits of $3 a square foot, clearly the health benefits are larger than the difference in cost between a cool roof design and a conventional design. So just looking at the health benefits from a city perspective leads you to say, hey, this should be our standard design policy. I should say, in addition to Lynn and Brendan, one of the other people advising and guiding on this is Sean Cahill, who's the chair of the DC Building Industry Association. I think one of the great things about DC government is it works extremely closely with its builders, so there's not an antagonistic relationship, but rather a cooperative one. We're also doing work with the JPB Foundation, looking initially at 4 cities, DC, LA, Philly, and Baltimore. And what I think is interesting here is that in LA, which doesn't have that much water, but when it does get water, that water runs off. What this suggests is that the DC policy of providing a financial recognition for capturing that water, putting it back into the groundwater table, having it not go into water treatment overflow is something that LA should do. They provide almost no benefit to stormwater, unlike DC. So these, again, are preliminary results, but overall what they're telling us is that cities have the opportunity to save an enormous amount of money, improve quality of life, reduce health costs, reduce energy costs by changing how they face the sun. Both the roofs and the surfaced areas in the cities can dramatically increase their albedo, their reflectivity, to get this large set of benefits. I'm going to turn to a couple of emerging technology areas that I think are interesting. Cities think a lot about Scope 1 and Scope 2 emissions, which is on-site energy consumption, and then electricity, which is generated off-site. But really we need to think also about Scope 3, which is embedded CO2. As a building becomes more efficient, the embedded CO2 in that building becomes larger and larger. A very efficient building can take 10 years of operation and energy consumption to equal the CO2 just in the cement that goes into the building. So cities are really moving towards acknowledging, documenting, and trying to reduce the embedded CO2. This is a company I'm involved in that we're have put some money into. I'm very excited about. It's created a pathway to capture 80% of the CO2 coming out of flue stacks and turning it into cement or cement products or road products. So we can go from cement being 6% of the world's CO2 and a very large part of DC's CO2 footprint to actually embedding and storing CO2 permanently in the building materials that we use. And by the way, this material is very high albedo, meaning it's very reflective, so there's a secondary benefit. There's a company called Blue Planet. Just one is actually deploying at scale at the DOE National Carbon Sequestration Center in Alabama next month, and we'll be getting test results back from that. Second interesting project for DC we invested in is urban agriculture. This is in the southeast. It's in Anacostia. First harvest expected in 2015. This will employ 25 to 30 people full-time equivalent, produce more than 1 million pounds of green produce a year. So it'll be harvested in the morning, sold in the afternoon, and eaten in the evening rather than shipped across the country. The CO2 reduction is 96, 97%. And the benefits in terms of quality of life, availability of fresh food in places that don't normally get it in the southeast is very large. So we're really excited about this kind of urban agriculture in terms of both health and employment and CO2. I put this up here because in our transition to a low-carbon economy, which DC is very much a leader in, and that's really the ultimate health driver for us as we think forward, is climate change. It really dominates everything else. This is a conventional residential consumption profile on the top. When you add in a learning device called Nest, it allows you to pre-cool and then reduce your cooling and allow the temperature to rise somewhat and then do the cooling afterwards rather than a conventional load shape. You can reduce your consumption at a residential level by about half. Same is true with different technologies for commercial. Why is this important? Because it does a couple things. It reduces energy bills, particularly important if you're low income. It gives people individual control over their meters, and people really like that. Third, you can reduce your CO2 consumption on peak by about half. And fourth, it enables renewable energy. So we're going to do a lot of PV in the city. That PV only provides electricity when the sun is shining. So how do you reshape consumption to allow you to use electricity when it's available? And one way to do that is to use the building as virtual storage. It's a very interesting kind of emerging area for control. Then the last technology and last thing I want to talk about is an initiative called Places, which we're a minority partner in. And so Places is an interesting concept. It's the notion of large volume, big data applied to real estate. And the thesis is as follows. The economic downturn we went through was triggered by mortgage failure. Why would somebody not pay their mortgage? Well, they might not pay their mortgage because the value of their home has dropped below how much they owe. They have negative equity. If I had negative equity in my home, I'd probably walk away from it. Why should I keep paying into something that's just a hole in the ground? Turns out if I live in a walkable, mixed-use, TOD-type neighborhood, the value of my home declines much, much less in an economic downturn. So somebody who lives in a walkable, mixed-use neighborhood, which is what DC is driving toward, there are 56 of them, by the way, in the larger DC region. If I get a home in that area, I'm actually a lower risk with a FICO score of 600 as a nurse than if I had a 700 score and I had a higher income but lived in sprawl. Second reason you might default is you lose your job and you're not able to get another job in the building you're in. That is much less of a problem in a walkable neighborhood with access to public transit. And third is sort of this NOI argument, which is the cost of a car is around $8,000 a year. So if I can do with one less car, I can save that much money. It's more likely I can repay. So you overlay this sort of location-specific stuff with a set of additional neighborhood things relating to transportation and to employment. And it turns out that this becomes a far better predictor for whether or not you get default than a conventional FICO score. So we actually mapped this with AIG, which is one of the largest 10 providers of loans. This is a 100,000 loan portfolio that they actually went through and they made loans. They did yes or no on all of them. They went back and applied the metrics that we've developed, and it turns out they would have saved $250 to $300 million by not giving loans to certain people who had relatively high FICO scores but were in sprawl and therefore had systematic risk along the risk attributes we talked about. Most importantly, they would have done another $5 to $6 billion in loans to individuals who did not have a high enough FICO score, but whose home was in a neighborhood that was associated with walkability, flexibility in terms of jobs, flexibility in terms of transportation. So this is very powerful because it says to cities, here's a way to think systematically about exposure to risk that drives value recognition from sprawl, away from sprawl, and towards walkability. Very, very powerful new tool. So that's my last item, and I turn it over to my friend and colleague, Brendan.